Okay, welcome everybody to the webinar today. My name is Jenna Hitchcox and I'm the Program Manager for the E-QIP team. Today we're going to be talking about trusting the quality improvement process for the community mental health and addiction sector. And with the E-QIP team, we use the model for improvement, so that will be the focus on our discussion today. So first off, I just wanted to thank everyone for taking the time to learn with us, and we hope that this webinar is valuable to you. So before we start, I just want to do a bit of a audio test. So if you're able to hear me, could you please type in the chat box that the audio is working on the side of the participants? Great. Okay, so I'm hearing that the audio is working, which is perfect. If the audio is sounding a bit choppy for you, you're welcome to dial in using the phone. We find that the phone lines are often a better and stronger connection. So I encourage you to dial in using a landline or your cell phone through the audio information that's on this slide in the orange box. Just a bit of housekeeping before we get going. If you have any questions or comments as we're working through the content today, please make sure to either put those thoughts or questions into the chat or question boxes in the GoToWebinar control window. We'll hopefully take as many questions as we can by the end. So just kind of type them as they come up. That would help us at the end to make sure that we answer everything that we need to. We also encourage you to look at the handout section on the GoToWebinar window that you have. If you click the small triangle arrow on the left-hand side, the two handouts for today are a link to our community of practice, as well as the slide deck for today. So you're welcome to download that and either follow through the webinar with us today, or you can use the deck at an alternate time if you want to refresh yourself on what we talked about. This webinar is being recorded, and we will post the handouts as well as the link on our community of practice for you to either rewatch at another time, or you're welcome to share the recording link and handouts with those that you're working with on QI projects. So the E-QIP team, we're trying to enhance our online presence, and we're becoming fairly active on Twitter. So we encourage you to think about following us on Twitter using the hashtag E-QIPON if you're part of that, or if your organization has a Twitter handle. You can follow where we're at and what we're doing using our hashtag. And also, if you're participating in this training or any other future trainings or webinars, please feel free to tweet to us and what you're learning and what you're experiencing through Twitter, and that helps us let us know how our community is responding to the offerings that we're providing. So the goals for participating today are really for you to hear from the coaches that are part of the E-QIP initiative. Many of you that I see on the line today have worked with them in the past. But they're really going to be who we're hearing from today. And through our discussion, we're hoping that you learn about the value and the challenges of working for the model for improvement, and specifically hearing from experiences from the QI and data coaches that are working with the model for improvement. And also, for those on the line, we hope that what is shared with you is quite relevant to what you're doing, as all of the experiences that we're sharing are coming from the community mental health and addiction sector. And then at the end, we're going to provide you with a slide on some additional resources where you can continue to understand the value of the model for improvement, and some resources that will guide you on how to actually apply the model to the work that you're doing. And then, of course, at the end, we'll open up for some questions. Again, please type them as they come to you throughout the webinar, but we'll hopefully take some time at the end if we have enough to answer your questions. And just a little bit of a caveat before we get going. I think something that the coaches and I talked about before or as we were planning this webinar is that, for those of you on the line that have used the model for improvement or are in the process of learning it and applying it to the work that you're doing, we hope that this webinar will be validating and that we're going to be really open and honest about the challenges of using the model for improvement, but also provide you with some tips and strategies to be able to kind of overcome those challenges of staying true to the model. And so we hope that that is validating for you to hear that, it's a great model to use, and if you use it well, it can really work. But there's also some challenges that come up throughout a project life cycle that make it challenging to stick true to the model. So that is our hope for you today. If you're new to the model for improvement, or if you haven't had the opportunity to apply it, we hope that this will inspire you to take a little bit of what you learned and explore some of the tools that we'll be talking about today and apply it to the work that you're doing or you would like to do in the future. So we're going to take a few minutes now just to introduce ourselves. So I've introduced myself, but my name is Jenna Hitchcock. I am the program manager for E-QIP.
My name is Nicole Atkin, and I'm a quality improvement coach with E-QIP.
Good afternoon. My name is Alex Clement, and I'm also a quality improvement coach with the E-QIP project.
Hi, my name is Laura Daly-Troche, and I am also a QI coach for the E-QIP project.
And hi, my name is Anna Mudimba, and I'm a data coach for the E-QIP project.
Great, thanks. So this is our fantastic coaching team, or some of us that work with the E-QIP project. And I just wanted to thank each and every one of them. They put a lot of thought and effort into this webinar, and they're joining from all across the province today. And so I just wanted to take a moment to thank you all for your effort and for taking the time to be with us. So before we get started, we just like to ask at the beginning of our webinars for you to, let us know where you're calling in from. So what organization are you representing? And if there's several of you or more than one of you joining us today, please type in the chat box how many different folks are joining with you. So we'll take a minute to do that. Great. All right, so we're hearing from people from all across the province, which is great, and some organizations we've worked with in the past and some we haven't. So I'm happy to have everyone here, and again, hopefully this webinar will be useful to you. So the E-QIP initiative, just for those that may not be familiar with our work, is a partnership project with Addictions and Mental Health Ontario, CMHA Ontario, and Health Quality Ontario. We are an initiative that's intended for the community mental health and addiction sector in the province of Ontario. We do a lot in terms of building on the great work that we know is happening in our sector. In terms of there's lots of great improvement initiatives happening, and the providers that we work with are so passionate about improving the care and making sure that people are getting the care that they need. So we try to build on that and make sure that we're kind of harnessing that energy and teaching people how to apply QI methods to those really good intentions. And so we do a lot of teaching on QI methods, and we do coaching to make sure that those methods can be applied in a way that is helpful from a client perspective with the agencies that we work with. So there's lots of different offerings that we provide the sector. Our biggest would definitely and most intense would be our coaching support. We do a variety of different trainings and education events, so both in person and online, like you're receiving today, as well as we have an online community of practice where we link everyone together online to share resources and stories about QI in our sector. So that's a little bit about us. We'll talk a little bit more about the community of practice later on in the webinar. So this is how we, as a E-QIP initiative, as well as the province, defines quality improvement in healthcare. I think one of the main reasons why we want to do quality improvement work, in our sector, but also beyond our sector, is to improve the care for the people that we're serving, and making sure that the outcomes that people are experiencing, as they're working through services or programs, are the outcomes that they want to achieve, as well as that their experiences in receiving care are as high as they can be. Something to keep in mind when we're talking about quality improvement is that we're never done quality improvement. It's a continuous process. So that's kind of one of the values that we've adopted as a project. And it's also about working together. So taking experiences from providers, clients, family members, administrative staff in your organizations, frontline management, senior executives, and all the way up to the board. QI is really all about taking, all those different experiences and making care better, again, for the people that we're serving. And so these are the three models that the E-QIP team works with. I'm going to start on the left-hand side. And this is the quadruple aim, which is essentially our ultimate goal of doing quality improvement work. So in everything we do, we're hoping that we're making health better for the population. We're giving better experiences and care for the individuals that we're serving. We're improving provider satisfaction in the work that they're doing and the care that they're providing. And we're hopefully getting to lower costs by using our resources more efficiently through QI. And so this is kind of the guiding light of quality improvement, and everything that we do, we hope to be impacting at least one of these aims through our QI work. The model in the middle is all about the domains of quality, and these are kind of the aspects or domains that are important for a high-performing healthcare system. And so these are very much adopted by Health Quality Ontario and the E-QIP team, and it's really all about making care equitable, timely, client-centered, efficient, effective, and safe. And so the way that we can understand this is that each of our projects should be targeting at least one of those domains of quality, if not more. And that's how we use this model, and it's really great for kind of focusing in your QI initiatives. And then the model to the left, the model to the left is the model for improvement. And the model for improvement is all about exploring how can we achieve those aims and make sure that we're working on those domains of quality in the best way possible. And so the model for improvement is really our how, and gives us tools and guidance of how to do QI work. So I'm going to pass things over to Alex, who's going to talk a little bit more in detail about the model for improvement.
Thank you, Jenna. So as Jenna mentioned, we do have a pretty eclectic bunch on the line today. So this may be a brief overview for some. This may be new for others. We could probably dedicate days to discussing the model for improvement, and I think I'm going to wrap it up in a handful of slides today. So this is our model for improvement. It looks very simple because it is. It's best described in its two components, being the top three questions and a cycle. So the questions that lend themselves to this model are: what are we trying to accomplish? How will we know that a change is an improvement? What change can we make that will result in an improvement? And then the cycle at the bottom, known as a PDSA, or a Plan, Do, Study, Act cycle. It's also known sometimes as a Plan, Do, Check, Act cycle. Same thing. And really, it looks very linear here because it's laid out that way, but just keeping in mind that this is a very dynamic process, and oftentimes we do kind of several iterations of each, or go back and forth, or work our way through the questions to get to the cycle and do multiple cycles of testing. So never to get discouraged if things don't look quite as well laid out as they are here. Some of the strengths of this model are definitely that it's relevant, it's stood the test of time, and it's been used in other areas, including healthcare and mental health and addictions. It's practical, evidence-based, knowledge-based, which is a base that we're building all the time, and it's inclusive, meaning it's not limited. It includes all stakeholders across an organization or a system of care, and includes all systems and processes. Some of the key principles to keep in mind when working for the model for improvement, and of course these kind of reflect those 3 questions we mentioned earlier. So know what it is that you want to improve, have a feedback mechanism in place to tell you if improvement is happening. So that kind of refers to our data and our being able to measure what's going on. Develop an effective change that will ultimately result in improvement. And sometimes we develop changes that we test and they may not necessarily result in improvement right off the bat, but that's okay because it's something that we can take back and work on and test again. So number 4 is test a change before you attempt to implement it widespread. So always start small with those tests of change. And number 5, know when and how to implement a change and make it permanent. So kind of hinting at that sustainability piece where we don't want to invest a lot of resources and a lot of effort in something only to see it sort of dissipate as time goes on. And we see here our models for improvement again on the right with our 3 questions and our cycle. And we have the foundations to QI and their tools sort of superimposed on that, where we discussed preparing for QI, including our problem statements and our improvement charters, understanding the problem, which is our diagnostic tools that we incorporate to kind of determine what it is that the problem is, and then we move on to measuring and understanding our system, talking about run charts and measurement plans so we can determine how it is that we're going to know whether a change is an improvement ultimately. And included sort of in these understanding the problem pieces are the experience-based tools that you see on the left-hand side, talking about capturing, understanding, improving, and measuring. And these all help lend to an approach where we get input from clients as well as staff and all other individuals that may be touched by a process. And then once we understand and know how to measure our system, we can go on to developing and planning solutions, generating those change ideas, and determining which ones are going to have the most impact and effort. Then moving on to our PDSA cycle, or plan, do, study, act cycle, and testing and implementing those changes, and then ultimately moving on to sustainability and spread, making sure that those gains that we've made are carried out in a long-term sort of way. And I'll hand it back to.
Yeah. So that's a really great overview from Alex about the model for improvement, just to give you a little bit of context about what we'll be talking about with the other coaches today. But first, we wanted to start with a poll. And the poll is asking you to vote on, are you currently leading or part of a team for a quality improvement project? The options are yes, you're leading a QI project, or yes, you're part of a QI project team. No, but I want to be part of a QI team, or no, I am new to QI and here to learn. So we'll take a few seconds to for you to answer that. All right. And we'll share the results so we can see. So most of you seem to be either part of a QI project team or leading the QI project, and a few of you are new to QI and here to learn. So that's wonderful. We hope that no matter where you're at in your QI journey, you'll take something away today. But it is nice to know that the majority of you are currently doing work, and for those that aren't, we're happy that you're here and hope to inspire you to start. So now for the main event of today, we're going to start our discussion with the QI coaches and data coaches that are on the line with us. Again, we hope that the conversation will hopefully give you some practical advice based on the experiences of those that have used the model for improvement in the work that they're doing. We also, this advice is coming to you from experience in the sector, so we know that the community mental health and addiction sector does have some major challenges in doing good quality improvement work, but we're hoping that the experiences that you hear today encourage you to know that it is possible and that there's ways to overcome those challenges. And again, if you have any questions as we're working through the panel discussion, please feel free to type them in the chat box and we'll get to them as soon as we can. So our first question is about preparing for quality improvement. And so if we think back to the last slide that Alex presented, preparing for QI is really all about articulating the problem and making sure that we understand what the problem is before we try to move ahead and diagnose what's happening. And so the problem statement is one of the main tools that we use to help with this, and the problem statement is all about having a few sentences that are really clear articulation of what's happening and why the problem is a problem for the clients that we're serving. And so our first set of questions is, can a problem statement make or break a quality improvement project? And in your experiences, what makes a good problem statement to kick off a successful quality improvement initiative or project? So we'll start with Laura with this question.
Thanks, Alex. Jenna. And Alex, too, for that demonstration of the model for improvement. So I'm just going to say there's two things for me that stand out with regards to what makes a good problem statement. One is being that there needs to be data that supports the statement, and that there is some sort of client voice added into the problem statement that says, what is the so what? And if you can add those two pieces into your problem statement, I think you will have a great problem statement. One of the projects that I worked with used qualitative and quantitative data to support their problem statement. And had they just looked only at their quantitative data, they may not have come to a scope of project that was doable within the time frame that they had set out on. And by adding in the client voice, they were actually able to narrow their focus, which I think was a really important piece for that particular project. And the other piece that I think was really important is that the project also aligned with the organization's strategic plan, and so that it actually fed into the larger goal of the organization, and that it wasn't just a standalone project, that it actually had meaning to others outside of the project group. And so when you're thinking about your projects and developing your problem statements, think about your strategic organization's strategic goals and plans and see if it aligns with that.
Great, thanks so much. And I know, Alex, you had some comments on these questions as well.
Right, and I think oftentimes when we embark on our quality improvement projects, we start with the problem statement, of course, because what is it that we're trying to improve if there isn't a problem? And this is sometimes actually the hardest part for teams, is really clearly articulating what exactly is the problem, sort of defining that current state, and like Laura said, kind of determining what that so what is. And just in my experience, I know that the teams that have had to go through several iterations of a problem statement, which is totally fine, sometimes they find that, you know what, we've got the team together, we're really ambitious and wanting to start a project, and it becomes this huge scope that may not be manageable for the organization or for the people at the table. So I do just want to caution that in order to be successful, you really want to pick something, and not necessarily pick, but articulate the problem in a way that it's something that's going to be within your control and within your scope, because it's going to be impossible to affect change to solve that problem if it's, say, something like a mandate or something that's funding driven and something that we don't actually as an organization have control over.
Mm-hmm. That's great. And Alex, I know you also had some thoughts on making sure that quality improvement projects are kind of more client outcome focused, and if there's some advice you can give on how to make sure that your problem statements are client driven, that would be great.
Yeah, of course. So I know oftentimes as project teams and as organizations, we know really well. We know our job and what it is that's giving us some grief as frontline, as management, as administrative staff in an organization. And again, it's just kind of defining that so what. So we're here to provide services, of course, and when we start talking about things that are very process oriented, so for instance, staff not completing plans of care, for example, or no-shows, for example, those are very process driven. So we will be able to affect some change there, but really determining that so what and making it client-centered, client-oriented in terms of those domains of quality that you mentioned earlier, Jenna. So things like, okay, so we know that if clients aren't getting accurate plans of care, what does that mean for them? Does it mean that they're not getting the quality of care that they require? Are they not going to be experiencing positive outcomes? Really kind of boiling it down to the so what and what it is that we're all here for.
Fantastic. And I find when you kind of build a quality improvement around the client voice and client outcomes, it really grounds everybody and really refocuses us on why we're doing what we're doing, and it's a good motivator that way, and making sure that we're driving change for the right reasons. So thank you. Does anyone else have any additional comments on the importance of a problem statement or kind of what's up on the screen right now? Very good. Great. So the next thing that we wanted to talk about is the diagnostic tools. And for those of you on the line that are a little bit newer to QI, the diagnostic tools that we talk about are in the E-QIP world, but also in quality improvement in general for healthcare organizations. We talk about the fishbone diagram, which is a way to kind of brainstorm all of the causes as to why a problem is happening. So once you have a really clear problem statement and you know what the problem is and how it's impacting the people that you're serving, the fishbone diagram is a really great tool to help you kind of brainstorm why it is that is happening. Process mapping is also a common tool that we use through diagnostics, so looking at a process from beginning to end. So one that we commonly work with in the sector is the intake process, from when a client calls in for service until they get that first kind of point of care. That's a really common one we use. We also use the 5 whys, which is asking why a series of times until you really dig down into that root cause that's impacting your problem, as well as we're also trying to use experience-based code design at the diagnostic phase. So asking the people that you're serving, how they're feeling and why they're feeling that way, to really get to some of the root causes that you want to be tackling through your QI work. So I just wanted to throw that out there because I know that there's some on the line that QI is new to. But when we're talking about diagnostic tools, we're really focusing in on why is something happening and what is the root cause? What are a few root causes that we can focus on and really make our QI project impactful for the people that we're serving? So that's just a bit of background. And so we want to open up for discussion with the coaches on and give them an opportunity to explain their experiences using those diagnostic tools and the impact that the diagnostic tools can have on a QI project. So we'll start with Laura.
Thanks, Jenna.
Oh.
Am I okay to go ahead?
Yeah, go ahead.
Okay, sorry, I just heard somebody talk, so I just wanted to make sure it was all right. So with the diagnostics tools, I guess my experience with that has obviously been very broad. I had a lot of experiences with different teams and the different types of diagnostic tools. And I think the biggest learning that teams have had is if they've gone through the series of diagnostic tools, so as you say, they have their problem statement, and then they've done, for example, a fishbone diagram, and maybe even added in experience-based co-design, and asking the client about their experience. If they haven't done, one particular team I'm thinking about is they had done those two tools, but still hadn't come down to anything that they could really put their hands on as far as what they could affect and work on to improve. And it wasn't until we introduced the idea around process mapping that they were actually able to focus their project. They found out where some of the gaps were in their process steps. They also found out where there was duplication and rework, and they were able to start working on some change ideas to affect that. Had they not done that, they would have still missed those pieces and then possibly moved forward with their project and ended up not with a result that wasn't what they were looking for from the perspective of an improved service. So I guess the message that I have here is that if you're working through the diagnostics and you're still not getting what you're looking for, or it's still not meaningful for you, it's okay to do a rework. Sometimes doing the fishbone again, or looking at the data in a different way, having other people's input, so making sure that you have everybody that's involved in the process that you're trying to improve, for example, making sure that all of those individuals are part of the conversation. I think that's really good learning that teams have had. And QI work, it doesn't happen overnight. The results don't happen overnight, and you have to put the effort in, and sometimes it gets messy, and it does take time. And so even though you've set your goals to be, 6 months, I want to have this working at a certain level, sometimes you have to extend that. It's kind of like construction work. You have a date that you set for, the kitchen renovations being completed, but then you have to take it a little bit further because of things that you couldn't foresee. And so the diagnostics can be challenging, but it's normal to get bogged down in it and have to do reworks and do-overs of fishbones, for example.
Great, thanks. And I know, Alex, you had some thoughts on this as well?
So in my experience, it's always really valuable to collect information when you're doing the diagnostics from all those that are involved. So one organization that I worked with in particular, they were kind of focusing their quality improvement efforts on a particular process that had a lot of impact on clients. So they were able to use an emotion survey, which is one of those experience-based design tools that we mentioned earlier, and they were able to collect information directly from the clients regarding how they felt at certain points in the process. And from that information, they gleaned a lot of really valuable insights from the clients because it was so impactful for them, and those later informed the changes and the tests that they wanted to try out to help improve this process overall. But the information they collected was actually so helpful that in the spirit of continuous quality improvement, they used that tool to debrief with all of their clients afterwards and to continue collecting that information to always be improving their process as best they could.
Great. Does anyone else have anything to add on diagnostic tools or your experience using them? Okay, great. I know, Laura, what you were saying about sometimes you have to do them more than once, can often be frustrating, I would think, for teams. But just hearing that is sometimes necessary and it does help things move forward is really helpful to share. So thanks for doing that. So the next question is all about the part of the improvement process about understanding the problem. And it's all about, our experiences in making a really clear aim statement and the power of a good aim statement and what that means for improvement work. And so, again, if you're more new to the QI process and you haven't used these tools before, an aim statement is really all about having some sort of, a one sentence guiding light for all of the work that you're doing. And it really is going to be answering the questions for what, by how much, and by when. And so, a really generic example of an aim statement for a QI project, the way that the E-QIP team works would be, we want to reduce wait times for our case management program by 50% by March 31st, 2019. So that's what we're talking about when we're going to be discussing the aim statements. And so our questions around that are, what makes a good aim statement, first of all, and how can an aim statement contribute to the overall success of the project? And so perhaps we'll start with Nicole for this question.
Sure, thanks, Jenna. The aim statement is a really important part of your project in my experience. It's a little bit easier to write sometimes than the problem statement because it has those three components. It's smaller than the problem statement. And once you've done the work of discovering what your problem is and then using the diagnostic tools to understand what's causing your problem, it is a little bit easier sometimes to indicate where it is that you want to go for the remainder of the project and what you want to focus on. One of the things in my experience that is really important when we are working on aim statements is the language that is used in an aim statement. And it's so important that when the team is working together, that everybody understands and shares common definitions and uses common terms in the same way. So an example of that I have is the project that we were working on, and the problem was indicated, the root causes were diagnosed, and we were going to focus on an aim statement that had us increasing the number of collaborative care plans for clients at that organization. And it was a fantastic aim. We set it out. Everybody left the meeting. Things were really good. And then what came to light was there was confusion around that because people weren't defining care plans in exactly the same way across the project team. So we had some of the team members who were frontline staff indicating that they were doing collaborative care plans 100% of the time. And so it was confusing in terms of what then was this project going to focus on. So after some discussion on that, it also became apparent that it was going to be a little bit harder to measure exactly when a collaborative care plan was done, since people were not defining it consistently across the team. So that it came out that there were two really important components of the aim statement that were really going to be quite fuzzy and we weren't going to be able to measure them. So back to the drawing board we went, and then finally came up with an aim statement that was going to increase face-to-face time. So that seemed to be a little bit easier. The team really was able to articulate and have a common definition of what face-to-face time is, and then combined with a manual tracking sheet and their client software, they were actually able to a lot more easily measure face-to-face time with their clients. So they were able to carry on with that aim for the rest of their project.
Great, thanks. And Alex?
In my experience with aim statements, I find that really the more clear and concise the statement is, the better, because you really want this aim statement to answer that question, what is it that we're ultimately trying to achieve, which lends itself really well to mapping that theory of change. And when I say that, I mean all the actions that you're taking as part of your project. So whether it's measuring certain data points, collecting other information, or the changes you're making, you can say that we are doing Y to ultimately accomplish Z, our aim, or we're going to accomplish Z by doing X, Y sort of thing. So ultimately, this really helps ground where the change ideas are coming from. They're making it very easy to measure because you know exactly what it is within the scope. So the need to know versus the nice to knows. And also it has a very finite end. So we don't experience that sort of scope creep where we started out with one project and it sort of snowballed into this massive undertaking that's never going to end. So again, clear and concise as much as possible.
Great. Okay. And I'll just mention a comment that we've had from our participants on the last kind of area we talked about in terms of the redoing diagnostics and taking your time at that stage of the project. The participant said the primary complaint that they hear is the whole process takes too long. It feels like they're not doing anything, and so I think that's something that we often feel as the E-QIP team as well. We often are reining teams back. From what I hear from the coaches, they're reining teams back, not trying to stop motivation in any way, but just kind of reining people back in to really diagnose a problem. And the whole idea of the model for improvement is if we can diagnose the problem well at the beginning of a QI project, we'll be able to have those more impactful solutions at the end of the process. So thanks for sharing that. And to the points about the aim statements, I would thank Nicole and Alex for their knowledge on that. I think it's really important to have manageable aim statements and making sure that they're clear. I think the best QI projects that we work with are often the ones that are really easy to understand by just reading their aim statement and then asking how things are going. It really helps with that communication piece that's so important to QI work. Okay. So the next thing that we want to talk about is data, and measuring and understanding your system is a really big component to QI work. And so we often are promoting the use of data, right from the beginning of a project all the way until the end. And so we wanted to have a bit of a discussion about that today. The questions that we'll talk about is what is the role of data in a QI project? And if the coaches that are explaining that could provide some examples of how data has helped the project stay focused and shown success. So we'll start with Anna.
Thanks, Jenna. One of the roles that data plays when it comes to the model for improvement is that it's a feedback mechanism that helps us know if improvement is happening. But the one thing that is prior to that is that projects need to have baseline data established in their problem statement. So like Laura and Alex have mentioned in the sections before, it's really important that organizations either pull baseline data from their software or establish baseline data by doing like a simple collection, say a snapshot, or if they have any collecting data when it comes to paper and kind of consolidating that in a way that it could be looked at to see if there's a problem. So that's essentially the one part where it's a big chunk to support the problem statement, and that goes through the diagnostics and stuff like that. So it's a really good way to anchor a QI project and kind of show you in what direction you want to go. The second kind of bucket, once you've figured out once you've done your diagnostics and you know what your aim statement is, there's three measures. The outcome measure, which comes from the aim statement. So if you want to decrease wait times, the outcome measure would be your average wait times. And then also you would want to put in place process measures. So that's when you implement your change, you want to make sure that you are assessing the process that you're doing by adding measures to it. So those are two different buckets where data, it shows the role of data. But the one thing that was said in the beginning when Alex was talking is that it's a part of it's a fundamental part of the model for improvement, and it's used as almost like a thread within the quality improvement project.
Great, thanks so much. And Alex?
And I think Like Anna was saying, just having that baseline information right at the on-site is incredibly helpful, realizing that not all situations is it freely available, and that you may have to start collecting that information before you start your changes or you're testing those change ideas out. A couple of projects that I've worked with, it wasn't until we determined our problem statement and the diagnostics were more or less completed, and the project teams did a wonderful job following those steps of the model for improvement, that we actually got our hands on some data that sort of indicated that what we had initially thought was a problem was not, in fact, happening nearly as often as people sort of anecdotally felt like it was happening. Although it was a pretty serious occurrence when it did take place, just the volume didn't really necessarily indicate to us that it was a problem, which brought us back to our diagnostics and said, okay, so why is this happening? And then we were able to see that what we were measuring was a symptom of an actual other issue. So for those that are a little bit more familiar with the model for improvement, realizing that there's the outcome measures and the balancing measures. So what we had initially thought was the problem was a symptom of something else and was later used as a balancing measure as we worked through the rest of the model for improvement.
Yeah, really important lessons there, I think, for the sector to consider. When we speak about data, often there's a little bit of fear in terms of what the data can tell us, and that's one side of it. The other side of it is that folks might be unsure where to look for data, or may not have the systems in place to get the data that's needed for QI. I'm wondering if I'll open it up to all four of you, if any of you can just, off the top of your head, share some of the simple ways that you've collected data in the past with QI teams.
Hi, it's Anna. I actually have a couple of teams currently right now that we're collecting a snapshot of data, and essentially it's just kind of like having an Excel spreadsheet, putting down the components of data that we actually need, and then having people collect that data for a period of time and then coming back to me and us looking at it to see what the data is telling us. Another way is a lot of agencies tend to have paper. They collect a lot of data when it comes to their clients and then put them in paper files. A lot of times what I do is I have a conversation with what elements, especially when it comes to client services, are you collecting, right? And then naturally we have conversations about that. And I was like, sometimes it's organizations who don't necessarily use their systems when it comes to data tend to have a lot of information when it comes to collecting things on paper. So I work with them to kind of establish different indicators that I want them to kind of pull out that information so we can kind of categorize it so it could tell us a bigger story. And I've had a lot of success with actually 3 agencies by establishing things in that way. And then after that, especially once they see that it's indicating a problem, it has everybody more on board to collect that data in a more meaningful way going forward.
Great. Thanks. Anybody else have thoughts on that one?
Sure, it's Nicole. I am working with a team right now who is working on referrals being made to other organizations, and they have simply put a piece of paper at the reception desk so that when clients come in and they're referred to specific places, they're simply just putting a check mark under each day on the piece of paper. So that way they can keep track of those referrals that are being made. But then if the person who doesn't always sit at the desk is not there, whoever is filling in for them is able easily to track that data on the piece of paper. So it really is quite simple.
Yeah. Fantastic. Great. Okay, so those are, we could probably talk about data all day. We have lots of thoughts and opinions on that. And, based on the sector survey that the E-QIP team rolled out twice now, both in 2016 and 2017. We know that there are struggles in the sector in terms of getting the data to help and support QI, but also having the knowledge and expertise to understand, what to do with that data if and when you get access to it. And so, we do talk about data a lot, but as Anna and Alex are suggesting, it's really important for you to think about data right at the beginning to make sure that, the problem that you think you're having is a problem and to the degree that you think it is. And then, moving towards the end of a QI project or kind of middle, I guess, of a QI project, once you have a few change ideas or solutions that you want to try, is that outcome measure is having the effect that you want it to, and really the only clear way to tell us that is to have data being collected. So thanks for the coaches for your thoughts on that, on data. And we'll move on to the next question, and it's all about plan, do, study, act cycles that Alex mentioned before. And so one of the really important messages that we push and the model for improvement pushes is to start small. So if you have, you've done all of your diagnostics, you know what the problem is, you have a few ideas about what changes you can make that will actually impact those root causes and achieve that aim that you're striving for. Once you have a few of those ideas in place, how do you start and see if those changes will really work? And so what the model of improvement encourages us to think about is how can we start small. So we're not going to say, okay, we think we know the answer, so we're just going to say that we're going to, amend a process, and this is the way that we're going to do things from this point forward. The model for improvement is all about how can we test that in a small way with one provider or one client first, and then gradually roll out that idea until, it does become the new way of operating once we know that it works in a variety of different ways, in a variety of settings, with a variety of providers and multiple different clients that we're serving. So that's really all the PDSA cycles in a nutshell. That's really what the PDSA cycles are all about. It's about starting small and having conversations about what worked and what didn't and how to move forward. So that's just a bit of context into the next question. But the question that we wanted to ask the coaches are, why is it important to start small when testing change ideas, and to provide some of your experiences and examples on that. So we'll start with Nicole.
Sure, thanks, Jenna. I think you captured it well about starting small. We really want to make sure when we're doing a PDSA, we've done so much work up to now, that we want it to be that old saying, tried, tested, and true, before we actually are spreading it across, to the entire organization or the entire department. And the only way to make sure that something is tried, tested, and true is to start on a really small scale, test it out with a few people, work out any kinks, test it again, keep working out the kinks, so that by the time you get to that spread phase, that you have a really polished change idea that you want to put forth. And I think one of the teams that I had worked with in the past, they had, like every other project team, had done so much work and put so much thought into their change ideas and how they could make changes that really would move them closer to accomplishing their aim statement. And they had a data tracking spreadsheet that the organization uses to track their caseload, and they were needing to mark down some specific dates about client interactions. And they started really small. They started as they should, and as it was easy to start, just with their project team, the couple of people in that program and their project team. And then the intent was that they would then include a few more people from that program, maybe not necessarily on the project team, but from the program. But unfortunately, what happened was it was rolled out to the entire organization. So you can see that there was probably some confusion and things among the other staff members, and they really weren't quite sure what was going on. So what ended up happening was they weren't able to go through that process of making the changes needed so that everybody would fully understand what they were doing and why they were doing it and the value that they were actually going to be recording this data. So in the end, it was really hard for them to roll back that change organization-wide. That was rolled out. They ended up having other staff members who, again, just didn't quite understand what was being asked of them. And then once they started adding data that wasn't relevant to what the project was happening, you could see that then creates a little bit of a mess. So in retrospect, ideally they would have just kept on adding, a couple staff members at a time to collecting this data, so that they would have been able to make sure that the process was perfect once they rolled it out to the organization.
Yeah, right. And Nicole, when we teach PDSA cycles, that's often the non-model for improvement way of making change is often having that grandiose scale of implementation first and saying this is how we're going to do things from now on. And so when we teach QI to agencies, we really try and get them to step away from that. But it is, challenging to do that because as you say, you've put so much work into your QI project. You've done a lot of work in diagnosing the problem, and you're just really eager to get going and test changes, right? And so I think that's something that a lot of us can relate to, and it's fairly common. And Laura, I'll pass things over to you now to talk about the power of starting small.
Yeah, thanks, Jenna. And I think it's that enthusiasm, right? That building of enthusiasm that happens as you're developing your project and getting to that point where you can actually implement and change ideas. Like, it's really, really exciting. And because you can see the light at the end of the tunnel. And I think that is where teams can get derailed when it comes to the change ideas, because you've been working really hard at it and you have an idea and you just want to go with it. And I guess my advice just from the top before I get into an example is just have a conversation before you even start working on your change ideas about, these are the rules of engagement when it comes to change ideas and PDSA cycles, that we really are going to be thoughtful and slow, and this isn't going to happen overnight, and just kind of put some rules out on the table for folks. And so there's a couple of things I've experienced. I had one team that just one of the members went rogue and sent out a change idea to the entire universe of the organization, and it really it had a very negative impact on the project progress. And so making sure that everybody is on the same page at all times and not going rogue and taking that enthusiasm to the next level without everybody else kind of behind it. And I think the second thing, the example that I'm going to share is just around this organization that I supported just recently through some PDSA cycles. And they did some really great work around the planning. And so they had taken the change idea, and then they set out a plan on how they were going to run these cycles and who was going to be involved, where it was going to be focused, which program, which case managers, and they really put some thought into what their hunches were around what the results would be at each cycle. And they started out in the early stages just developing, and their project was around having conversations with their service recipients around goal planning. And they realized early on that they didn't, as part of their diagnostics, that they didn't have a kind of a framework around what that discussion should include. And so they developed kind of the framework of that discussion. And then they tested it out amongst themselves in the project team, but just from the language perspective, is it incorporating all the standardized pieces that we wanted it to incorporate? And then they asked the advice of a person outside of the project team. And they asked, it was a seasoned, somebody who had been with the organization for quite some time. And then they also took that and tweaked it based on that person's input, and then asked somebody from, somebody who was new, a new graduate coming into the organization in a case management position, what their thoughts were around the discussion and the conversation points. And through that, they were able to then create a better document and a better framework. And then they tested it out on one service recipient the following day. And the cycles took less than a week to move through them. So it was really quick. And then they started just ramping that up. And we talk about PDFA ramps. And every time you scale it to a larger group of people, that's considered ramping up your PDFA cycle. And so they just worked through that really slowly and really thoughtfully, and all the time collecting some data. And they're still working through it, and they haven't finished with their final product. I still have to do a check-in with them to see where they're at with that. But they've been really thoughtful, and I think the planning at the very beginning was the key for them. And I think just curbing the enthusiasm, reining it back, as Nicole described as well, and then just being really thoughtful and methodical around the rollout.
Awesome. Yeah, it's really great advice, and I think the top tip that's on the screen right now is really difficult to do, but I think some of those little tidbits that you've shared, both Laura and Nicole, on having those conversations at the get-go and making sure that people understand why it is important to start small, and that's kind of the expectation during this project, especially if you're trying to use the model for improvement, is really important. So I thank you both for sharing that. The last area that we want to talk about, but certainly not the least important, and in fact, we are really strong advocates for including client and family member, the voice of the people that we're serving in the QI work that we do. So we just wanted to have a conversation on that topic. We've done a lot of work in this area. At the end of this session, I'll share with you some resources for you to learn more and to hear from project teams that we've worked with directly on how they have included and collaborated with clients and family members in their improvement projects. But just to give you a little bit of the taste of what we do and why we do encourage collaboration with clients and family members, we'll open it up for discussion with two of our coaches to talk about their experiences with QI work that have collaborated with clients and families. And we'll start with Nicole.
Sure, thanks, Jenna. It is a really important part of our work. I mean, at the end of the day, we're here to serve our clients, and I think we all really just want to do that in the best way that we can. And that is really something that E-QIP thinks is and finds is really important. And there's a lot of talk, a lot of times about projects being surrounded by processes as opposed to being surrounded by the client and having a client lens on that. And I think what people sometimes don't realize is a lot of times when you are looking at something from a client's perspective and how it's affecting them, it really does, in the end, it will affect your processes, and any changes that you need to make to help serve your clients better may be reflected in those internal processes and procedures that you may have thought was originally the problem. So when it comes to having a QI team, having a client and family member on the team is a really great way to get their perspective throughout the entire project cycle. And I've worked with a few teams that have had clients and or family members on their team, and they really do add a unique perspective. And I worked with one project in particular, and it dealt with housing. So there were two tenants on the project team, and as we were going through the project, and we were working out the diagnostics and completing a fishbone to try and come up with root causes of the problem, and then another diagnostic tool, the 5 whys, and then going through a process map of the various processes within that program, the client's voice at that table was able to bring forth a perspective that the staff going through this exercise weren't able to they weren't able to share, because we are on the organization service provider side. And although we hope to know, and I think a lot of times do a good job at knowing kind of what our clients need, we don't necessarily know always what they want and what all of their needs are. And there is no better way to understand that than to actually hear from the clients or the family members themselves. So it was a really rich experience to be able to get that feedback from those two tenants sitting at that table as we were going through the diagnostics.
Great, thanks so much. And Laura?
Yeah, and I'm a huge fan of this methodology, with the experience-based design particularly. And I think as we work through there's been several projects that the E-QIP has supported that have utilized that methodology. And I think the piece for me that's most important is, we often solicit the experience of the people through surveys, the people that we serve through surveys, or collecting anecdotal information along the way, and then we may make some changes. But I think the piece for me that's most important is that we actually involve the individuals that we serve in what the new process or new service might look like, and have them as part of the design of that. And so, I'm just throwing that out there because I think that's a really important piece to this. The example that I have is a really interesting example from my perspective. Is they applied the methodology of the EBD methodology to their project, and it was a process-oriented project. It was related to wait time between time of referral to service initiation, and which is a very common process that folks are wanting to improve on. But what they did was they applied the EBD methodology not only to the actual process steps, so how was that experience for you? What did you feel, and what about that experience made you feel that way? They also wanted to know, because the length of time was so long in between some of those process steps, they also wanted to know about the experience of that wait and how people were feeling, because they wanted to know, is it negative? Were people feeling anxious during that period of time, or upset, or whatever feeling that they had attached to their emotional questionnaire? They wanted to know if the wait time was problematic for individuals, and what it was about that made them feel that way. And in the end, they found out that the particular service that they were applying for, the individuals thought it was involuntary, and so during the wait time, they were worried that they were going to have their autonomy taken away from them. And so in this particular case, it was longer than 20 days that they were waiting. And it was impactful to the staff because they had no idea that individuals were feeling that way. And so you can imagine that the next meeting, when the individual came into the intake, for example, they might have those feelings of anxiety and fear coming into that room, and having not that knowledge, you might, if you had that individual, had that knowledge, they might not come into that meeting feeling that way, and might be more open to hearing about the service and what the organization can do to help them. And so it changed their improvement efforts. It changed the focus of their improvement efforts, and added in some of the layers that they may have missed had they not solicited that answer from those individuals. So just I'd encourage you to take a look at the methodology. It's a really great toolkit, and I know Jenna had mentioned she's going to share that with folks afterwards. And it's really easy to apply, and it has a lot of meaning, as Nicole said, to the people that are doing the work, because that's what we want in the end, is to improve the service for the people that we serve. So.
Yeah, very good. Yeah, I think we had a webinar last week on this subject, and I think something that stood out very clear to me, and what I'm hearing from both Nicole and Laura, is that the earlier you include the client voice, the better your your work will be, and the easier it is, when you do get to that the phases of when you're testing your change ideas to, include clients at that point as well, making sure that what you're testing is something that, is of value to the people that you're serving, because your project has been informed by them and their family members through, from the very start. So thank you both for sharing that. So this is a summary of our top tips that we've been talking about. I'm sure you've noticed that we have a lot of tips, and this isn't even the tip of the iceberg. I don't think some of the other ones that stood out to me today was the importance of linking your QI work to your strategic plan, so that it's really important to all levels of the organization to root your problems in the client voice and really understand how that problem is impacting the people that you're serving and their family members as well. Making sure that you don't get too bogged down with the data piece, but including it right from the beginning, even if you have to go really simple, like through a tick box or an Excel sheet. It's really important to do that so that you can understand your problem, but also see changes through data. I think, as Laura mentioned, those rules of engagement for when you do start testing your change idea is really important, and having that conversation at the beginning of when you're starting to do your PDSAs is really important for people to understand, what you're trying to do and why you're starting small, and how can we best do that is, again, really important to help with some of the challenges that come with testing changes. So, those are in addition to the ones that are on your screen. And I thank the coaches for their knowledge and expertise and time in sharing that with us today. So one of the last things that we want to do with you today is to get a sense of you about what you're taking away with you after we're done the webinar today. And if you could type in the chat box kind of your aha moment or one of the top tips that you'll carry forward with you in your QI work, that would be fantastic. We'll take a few seconds to do that, and I'll read out some of what we're hearing from folks. Take the diagnostic process slow. Yes, a big one. Really important. So maybe as people are typing, I'll go through some of the additional resources on this topic for you to think about. The first is we have lots of different webinars. All of our webinars, in fact, are based on the model for improvement. But the two that come to mind for you to check out after today is the myth-busting webinar. So that's where we take a lot of kind of myths that we hear from the sector, and we let you know kind of why that is a myth and strategies that you can take forward with you to help you in your improvement projects. We also have a quick QI webinar series that are short videos, about 15 to 20 minutes long, that will remind you of what the model for improvement is all about, in particular some of the specific tools, how to use those in the work that you do. We also have a new short snippet from two of the past projects with 3 improvement leaders in the sector that will share their experience using the model for improvement and why it was valuable to them. I encourage you to check that video out. It's not too long and it's really informative. We also have a resource folder for those quick QI webinar series on the model for improvement. The link is there. Some of our newsletter stories that we've highlighted in the past are from, one of them is from McKay Manor, and they talk about the importance of sticking to the model for improvement. And then in June, we highlighted our coach Nicole and one of the projects that she worked with, and they discuss how they've leveraged the model for improvement for that project. So some additional answers have been coming in terms of what you're taking away from today. One individual indicated that engaging clients and family members stood out to them. Testing change on a few people first stood out to another. And hearing from the presenters and an overview of the process helped another participant. So that's great. Thanks so much for participating. I'll go through the last slides, but if you do have any questions, please feel free to type them in, and we'll get to them in a few minutes. just some last items for you to consider. Our community of practice, the E-QIP community of practice, is where all of our resources live. We have online discussions on there, as well as we host all of the documents and tools and templates that we share through trainings such as this one, but also our in-person trainings. And if you are receiving coaching support, all of the resources from that experience are hosted on the COP as well. In December, we're having a discussion about the value for the model for improvement, and we're encouraging you as a QI team member or leader to let us know about what QI tool you've enjoyed using the most and how has it helped you in your work. And so if you log on to our community of practice, on our activity feed, you'll see that discussion is pinned to the top, and we encourage you to let us know. It doesn't have to be an essay or overly long, just a few sentences of what tool you liked and why. And we're actually going to take all of that feedback and create some additional resources for the sector, so a checklist or an infographic, something like that, depending on what we hear back from you. We're going to roll that up and share it across the sector so that it can, your knowledge and expertise on how this stuff actually works on the ground can be leveraged by others as well. Let's get that one. So some future E-QIP webinars coming up in the new year. We have one in early January on prioritizing quality improvement, where we'll hear from 2 improvement leaders on how they've driven their culture of improvement across their organization and making sure that it's a priority for staff at all different levels. We have an encore webinar on governance and the role of leadership in QI. We have that one coming up on January 24th. And then in February, we're very lucky to have Dr. Chris Hayes come and speak about the joy in work, which is all about how can we make QI improve the provider satisfaction and the joy they experience every day when they come in and serve the clients that they do. How can we use QI to make sure that we're not adding burden to the professionals and providers working in our field, but also how can we actually focus some QI projects on provider satisfaction and making sure that individuals that are serving clients are taken care of as well. And then the last one in March is all about sustaining your gains, and we're going to have a discussion about what are the challenges once you've seen success in an improvement project, what are the actual challenges in sustaining that and trying to avoid some of the risks of short-lived improvement projects. I've mentioned this, but our Quick QI webinar series is online on our YouTube channel. If you need a refresher or you're brand new to the model for improvement, I encourage you to work through that series. It will give you a very nice overview from the coaches that participated today, as well as a few others, on how to use those tools, and from really knowledgeable people that have used them and applied them in the past. And these are just some webinars for you to look at. The webinar number 8 is the experience-based design. If that piqued your interest on how can you actually co-design new services and programs with clients, please watch that one. And there's a whole host of others that you can read through and watch at your convenience if they're of interest to you. If you're not part of our newsletter, we encourage you to do that. It's a pretty simple sign-up form where we just need a bit of information from you, and then you'll get updates on the E-QIP project, including when there's additional webinars or trainings that you can take a part of. And this is our contact information. So the program directors are Debbie and Mike. They're always available and willing to talk about everything regarding quality improvement, and they're very helpful and knowledgeable on that. And myself, again, always happy to chat about QI with those in the sector too. This afternoon, you'll get a follow-up email with all of the resources that we've shared with you, as well as the SurveyMonkey link to let us know how this webinar went for you today. It's very quick, and we do take the feedback seriously and try to adapt our webinar program based on what we're hearing from the sector. So I don't see any questions coming in. So with that, I'd just like to thank again our awesome coaches who shared a lot of great expertise and knowledge today, and took time out of their very busy schedules to share that with us, as well as all of you for participating today. We hope that it was valuable to you. And again, please reach out if you have any further questions. Thanks so much.